All right, so we're gonna come in. Hi, Mom. How are you doing? And we're gonna introduce ourselves. My name's Dave. I'm an EMT, and it looks like you are gonna have a baby. So I'm gonna go ahead and get into my OB kit. So in the OB kit, you'll have several drapes to utilize. One of them should end up going underneath the pelvis of Mom. And if you don't have these drapes, and you're in a home setting, you definitely can utilize towels and what have you at the house. You need to start off with 2 pairs of gloves, and this outer layer is eventually going to come off once we prep the area for the delivery. And whether you're working on an ambulance or the fire department, you would want to respond with 2 pairs of gloves on, especially if you have an indication that an imminent delivery is about to take place. Okay? I need to find out from Mom if she's under a doctor's care, if they're expecting any complications. I also want to make sure that, when did the contractions start? How far apart are they? And if this is the first vaginal delivery. Now we're going to determine if you should be setting up and delivering here in the home setting. So the quickest way is to see if you have crowning. So I remove the clothes, underwear, what have you, and what I'm looking for is the top of the baby's head. And when I see that, I'm going to instruct Mom that, hey, congratulations, I'm going to make this a happy event, but we're going to deliver this baby here at this place. Grabbing my wipes, I want to try to clean the area as best that I can, and I open these up. I'm going to wipe from top to bottom in the medial portion of the vaginal opening. Then I'm going to turn it to a cleaner side, and I'm going to go top to bottom laterally, and then I'm going to do the same thing on the other side again, changing each side of the wipe so you're not wiping with a dirty side. So medial, then lateral. Okay, so we've cleaned the area. We want to get rid of the dirty gloves. Use proper technique for disposing of these gloves. And now I have clean gloves on. Okay? So I grab some type of a bandage. I'm going to put slight pressure on the head, and what I'm trying to do is control the rate of speed that this baby's going to deliver. Encourage Mom the whole time that she's doing a good job. Try to get her not to do those deep, hard push. And when the baby comes out, it will probably come out with the top portion of the head, and then it kind of will rotate one way or the other. So the first thing you want to do is look for a nuchal cord, and a nuchal cord is going to be a cord around the neck. Okay? If you should see that, don't panic. All you want to try to do is get your fingers underneath that cord and see if there's slack. There's going to be slack that's up inside the uterus. You just want to try to get some of that slack and get it up and over the head. If for some reason you can't make that happen, you'd want to take your cord clamps and clamp in 2 places on that cord, and then you would take your umbilical scissors and go between the 2 clamps and cut. I'm checking for fluid, and we got a little bit, so I'm going to suction. There we go. There we go. So everything's looking really good. Now, the shoulders could be hung up on the pelvic girdle. I'm going to put my hands on the head and shoulders, and I'm going to pull down on the upper shoulders, up on the lower shoulders, and there's not much holding on to this baby, so it's going to come out pretty rapidly. support the baby during the whole process. And when you get it down onto a table or floor or whatever you're at, you want to make sure that it's crying. So if it's not crying when it first comes out, you're going to go ahead and flick the bottom of the feet to get it to cry. Okay? So our baby's crying and screaming. We're happy about all of this. I can take a wipe, clean them off because they are covered in amniotic fluid and blood, and they can chill down. The other thing is you're stimulating them, kind of agitating them at the same time, so that gets them to cry even harder, which causes them to pink up. Okay? So, if the cord has stopped pulsating, then I go about 6 to 8 inches from the baby, another 2 to 4 inches from the first clamp, and you can cut it or you can just leave it clamped. Okay? So it's not a firm practice on what you do there. So we're going to leave it clamped, okay, and not cut it. I want to check my baby out. I'm going to do an APGAR. I do it at 1 minute. I'll reassess at 5 minutes. So let's keep this little lady here warmed up. We're going to put on the little hat. 25% of their heat can be lost through their head, so this is why it's really important that we do everything we can to keep them warm. I will tell you that the OB kits are all different. Some have nice warming blankets, and others will have Mylar. Okay? So get the baby nice. And you gotta work on your wrapping skills here. But you want these newborns tightly wrapped. Okay? They're a lot more comfortable when they can't move. Plus, you keep them nice and warm. And wrap it nice and snug this way. And then you would offer the baby to mom. Okay? Now, mom can attempt to breastfeed if she'd like. But at the very least, by mom holding the baby up around the chest, you get a transfer of heat, and you get the other important factors of bonding and all those types of things. Okay, so now the next step is we're going to wait for the placenta. If the placenta delivers while we're there, you want to do a quick examination. You're basically looking to see, is it intact? Does it appear like maybe there's a chunk, a divot or something that's out of the placenta that potentially is still up in the uterus? You'd want to notify the receiving hospital. They have a bag, so you can put this in, secure all of that. Everything's nice there. Now, the kits do have what is called a peri-pad. Okay, so it's just basically a very thick absorbent dressing. You're going to rest that there in the opening, and you want to monitor that. You're wanting to see blood start to darken, slow down, start to coagulate, clot. Okay? If for some reason that doesn't happen, you're going to have to massage the uterus or the top of the uterus, which is known as the fundus. Okay? And that technique is going to be deep tissue, pressing down into the uterus. It's very uncomfortable for mom. She's not going to like this, or you. But we're stimulating that uterus to kind of contract, and as it does that, it's going to pinch off hundreds of little blood vessels that come off the uterus to feed the placenta. Okay, so you need to take some of these things seriously, because you don't want this to turn into a hemorrhagic emergency. Okay, so always observe as you have those two patients in your care. Keep checking mom, keep checking the baby, make sure everything is good.